Hi everyone, I'm Denisse Gomez reporting for Caracal Reports, and today I'm interviewing Doctor Joseph Varon, who is the Chief of Critical Care Services of the United Memorial Medical Center in Houston, Texas. He's going to explain us the latest of COVID-19, the Delta variant, and the future of the vaccine. Thank you, Dr. Joseph Varon, to be with us and for your time. And I would like to ask you first, how do you see things right now with the Delta variant besides of last year?
I would say that the issue is chaotic, to say the least. We're having more patients that are coming in sicker. And when compared to the last year, I would say that things are worse. Last year, we didn't know anything about the illness. Now, we come in a year later and we recognize that we still don't know anything about this illness. Moreover, people are getting tired, particularly healthcare providers. So you're talking about healthcare providers that have had, a year and a half of working nonstop, and now they get hit with this new wave.
Is people taking longer to recover?
Yes, the things that are characteristic of Delta is that they don't respond like the prior strain did to treatment. The patients stay in the hospital for a longer period of time, and they come in sicker.
From your patients who are at the hospital and have been impacted by the COVID-19, what are the ages that you are seeing the most?
I mean, we see everything. We see absolutely everything, but I would say most of them are under the age of 60.
Okay. And what is your experience with babies? We are seeing a lot of news that babies are getting sick and it's getting worse with them. So
children clearly have gone, the incidence of COVID in children has gone up exponentially, particularly in the state of Texas. The number of admissions of children to children's hospitals are exploding. The number of deaths among children are exploding, particularly those between the ages of 2 and 12.
Is the perspective of getting the vaccine is changing between the people that is now in the hospital and then it's going home?
It's interesting. I mean, some of them, once they come to a hospital and they're very sick, they ask you to give them the vaccine right there.
Oh, okay.
But there are few. I mean, those who don't believe in the vaccine, they still don't believe in the vaccine while they're in the hospital. And remember, there is still a portion of people that don't believe in COVID. I have a patient right now in the hospital that he's very sick, and he thinks that we're making up everything to make him believe that he has COVID.
Even if you are vaccinated or not, why do you recommend to mask up right now?
Well, I mean, the fact is that we don't know what the vaccine will cover and what will not. In addition, remember that people that are vaccinated, they still can act as vectors to kind of spread the illness to others. So whereas they may not get any symptoms, they may not get sick, they may give it to others. So out of respect to the community, I think that we should continue to use the mask for the time being.
Yesterday, we get some news about the FDA that was approving the Pfizer. What are your thoughts about this?
I mean, the process of, or the difference between approving a drug and having it under emergency use has only to do with the speed of production. So, I mean, there was already enough data on the emergency approval that allowed them to give it to literally millions and more millions of persons. What I'm hoping is that those who were concerned about how safe the drug was or not, they will say that now that it's approved, they will get vaccinated.
Perfect. And right now we are hearing about the booster. So what do you recommend? Like to take it right now or wait a little bit more? Are your studies saying about this?
Most of the studies indicate that, you really have to wait about 6 to 8 months after the second dose that you got before you get your booster. There is a new study that just was published today about the Johnson & Johnson vaccine that actually shows that if you get a booster, you get a 9 plus increase in your titers. So I think that regardless of what you're going to do, you need to discuss with your healthcare provider what you're going to do. I personally think that everybody needs to get a booster, just like they did in Israel, or like they're doing in Israel and in some other countries.
Yesterday, Dr. Fauci said that US could control COVID-19 by March 2022. But we are near of the holidays and families are having reunions and people is getting together. So what are your projections or your prediction over this statement that he said?
The initial actuarial analysis that was done last year indicated that all these waves were going to be gone by March of next year. I mean, that continues to be the case. A lot of us believe in that. But for that to work, you need to have more people vaccinated and more people being careful on what they do.
Dr. Varon, on September 25th, City of Houston celebrates the proclamation of your day, Dr. Varon's Day. And this comes because of the MAT protocol, hard work that you have been doing with your studies and all the stuff that has been coming with the COVID-19. But how is it working right now with the Delta variant? How are your patients reacting over this?
The Delta variant is much more difficult to treat than the standard variant. And our protocol still continues to work. We continue to have good outcomes in our patients, but it's like you asked earlier, it takes longer for these patients to get better. So it's taking a long period of time for some of them to leave the hospital. So the hospitalization rate, which is already high, keeps those patients occupying beds that cannot be used for anybody else.
Thank you for your time, doctor, and thank you everyone for watching this interview for Caracal Reports.